Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Today we're going to deal with the topic of bonding the Herbst appliance or a bonded rapid palatal expansion appliance. And we have with us today Mr. Paul Gange of Reliance Orthodontic Products. Paul was very involved in the development of a specific adhesive for this type of large acrylic appliance. Paul, do you want to tell me a little bit about your background and how you got involved in bonding in general?
Yes, Dr. McNamara. My first employment in the orthodontic field was with Ormco Corporation for 3 years, and then I was recruited by Lee Pharmaceuticals to head up their orthodontic division. After spending 6 years with Lee Pharmaceuticals, during which time we developed several new adhesives, one of them being a revolutionary no-mix adhesive, which was called Unique at the time, I decided to venture out on my own and develop my own corporation, which is now Reliance Orthodontic Products.
Now, you are quite familiar with the general field of bonding. What unique challenges does bonding a large acrylic appliance like a Herbst or a bonded expander present to you as a manufacturer and distributor of such products?
Well, there are a couple unique characteristics that the material should possess. Obviously, it must have very, very high bond strength. It should have a very thin viscosity.
What do you mean by thin viscosity?
Thin viscosity, such as, for example, after the material is mixed, when it's applied to the appliance, you'd like it to have enough flow so that it will flow evenly throughout the appliance. The rapid palatal expanders, Herbst appliances, have various cracks, crevices, and quite a bit of anatomy to them. Therefore, a thinner material will flow better into the appliance, and then also when you seat the appliance, it allows the appliance to fit perfectly and to seat completely. Whereas a thick, viscous material may offer some resistance and may not assure a perfect fit.
Now
Also,
that's the opposite, in essence, to what you would normally expect with regular bonding of a bracket, right?
Absolutely, because with a regular bracket bonding, you want something thick, so wherever you place the appliance is where it will be, where it will stay, and there will be no flotation. Mm-hmm. And then the final criteria for having it viscosity thin is so that when the appliance is seated and placed in the mouth, that the excess paste will easily flow out of the appliance and can easily be cleaned up.
Okay. How about the working time? Is that something certainly from my perspective is very important? How does the working time of a specialty product differ from what you would normally use from bonding?
Well, because it's obviously it's being bonded to several teeth, multiple teeth, as opposed to a direct bond bracket, which is only one tooth. Therefore, you would need adequate working time for the staff member to mix the material, load it into the appliance, check the appliance and the paste in the appliance to make sure there are no air bubbles, have you seat the appliance, and then do your cleanup. And all of this has to be done during the working time of the material. If it's done while the material is going through what we call a gel period, or the period where it's starting to set, you can reduce your bond strength by as much as 70% in some cases.
Okay. I think it would be of interest now to go through the bonding procedure, at least a simulated bonding procedure, and I'd like you to address each of the steps so that the clinician can be aware of the things that you, as the manufacturer of the product, would be saying would be very important. Go ahead.
The first step, because the appliance that you've chosen today is an acrylic appliance, is we have to form a chemical bond between the adhesive paste that we're using and the appliance. Now, this is done by using a plastic bracket conditioner or plastic bracket primer, which is applied to the appliance in 2 coats. Your first coat is applied at least 1 minute before you're going to bond the appliance. The second coat would be applied immediately before you put the paste into the appliance. And this way you're going to guarantee that you'll have a chemical bond between the paste and the appliance.
Now, could this plastic conditioner be applied earlier than a minute before?
Absolutely. You could feasibly prime that appliance even 24 hours in advance, and then put your second thin coat on immediately before you're going to put the paste on the appliance.
Does the plastic bracket primer, was it soften the acrylic?
It actually conditions it, it opens the pores of the plastic so that the adhesive paste will then flow into the plastic and then set up your chemical bond. And it's a very simple procedure, nothing time-consuming and nothing where any degree of accuracy is required. Special care should be given to make sure that you do coat all areas where the adhesive will touch the appliance, to make sure that the adhesive does bind chemically to all areas of the appliance.
Can you use too much of the conditioner?
You could if your second coat was applied in too thick of a layer and the appliance was not seated properly, then once again you would not have good contact between your paste and your appliance itself.
All right, so the first step then is to do the initial conditioning, shall we say, of the plastic appliance. All right, now we've gone to the mouth, and either the chairside assistant or the clinician is going to prepare the teeth. So we're going to be, first of all, talking about using an etching material.
Exactly. Let me go back one step before that. Let me get into the first stage, obviously, of bonding, and that is the prophy stage, which is sometimes neglected to be done in detail. The prophy stage is a very critical stage of cleansing the pellicle that may be on the enamel surface off the surface. And it should be done with a rotary instrument using a flour of pumice or a paste that does not contain any fluoride or oil whatsoever. Fluoride or oil on that enamel surface will definitely inhibit the etch. That's why it's also recommended not to have a fluoride treatment within 2 weeks prior to bonding the appliance.
Okay.
Your next step after that would be an acid etch. We recommend, as the other companies do, a 37% phosphoric acid solution. This would be applied, in the case of the Herbst appliance or in rapid palatal expanders, only to the buccal or the lingual surfaces, never to the occlusal surfaces. This makes it easier for debonding at the end of treatment. The acid is applied in a dabbing motion onto each of the teeth for 90 seconds, never more than 90 seconds, and never less than 60. Ideally, between 60 and 90 seconds is when you get the maximum etch for the majority of teeth, regardless of fluoride in the water or prior conditions in the water.
How do you feel about the etching of the occlusal surfaces on deciduous teeth? Sometimes, if retention is a problem, that's something that can easily be done as well.
Very good point. Any case that you feel would require a longer etch, especially on deciduous teeth, because those would definitely require a 2-minute etching period. However, on any other teeth at all, stay within that 60 to 90-second period. And once again, stay off the occlusal. But on deciduous teeth or any area that you feel you may have a retention problem, definitely go to the occlusal and etch the occlusal. Be sure during this 60-second or 90-second period of time, whichever you choose to, as far as length of time to etch, be sure that you are continuously dabbing the etching agent on all of the surfaces to be bonded. And go back with fresh acid and continually dab. Never rub or never wipe, because you can definitely fracture the enamel tags.
What are you trying to do with the etch exactly?
The etch is nothing more than a deep cleansing. And because of that, it does require a thorough rinsing. Thorough, it should be at least 10 to 15 seconds per tooth if you're using a liquid etch. If you're using a gel etch, it should be 20 to 25 seconds per tooth. The reason why we recommend such a thorough rinsing is because one of the byproducts of the phosphoric acid are calcium phosphate salts that are created on the enamel surface. And these cannot be removed by just a quick squirting of water. They need copious amounts of water for 10 to 15, 20 seconds per tooth to totally rinse off these calcium phosphate salts and leave you with a clean, dry area to bond to.
All right, so that, for example, if you had 8 teeth in the upper arch, the cuspids, the first and second deciduous molars or first and second bicuspids, and then the first molars, you're looking at 120 to 160 seconds, basically.
Right, you're looking at a very long process. However, we feel that if the prophy stage and the etching and rinsing stage are followed to a T, this will end, your end result will be a lot better results throughout the whole period of treatment.
Okay. All right, so thus far we've talked about priming the appliance, the prophy, the etch, and the rinse, right? Now how about drying off the area?
On the drying area, it should be done once again with clean, oil-free air. And you can test this easily by taking your handpiece and just spraying onto a Kleenex or a tissue to see if there is any oil present. If there is, or if you feel at any time after you have etched, rinsed, and dried that there's a possibility of moisture contamination or saliva contamination, go back and re-etch for 15 seconds, and then go back through the thorough 10 to 15 second rinsing.
Okay. Now, at this point in time, you recommend putting on some type of a sealant, isn't that correct?
Exactly. The sealant actually with the Excel material is an optional step, but is one that is definitely recommended for two reasons. One, it does protect that etched enamel from decalcification. And the second is that it does make debonding of the appliance quite a bit easier because you're actually bonding to the sealant bonds to the etched enamel, so when you debond, you have a tendency to take more of the paste off the enamel surface and makes cleanup a little bit easier.
What's the purpose of the sealant?
Sealant does actually two things. It's a very, very thin viscosity, so it will penetrate very well into the enamel tags. When the paste is applied to the tooth in the form of the appliance, then that will bond chemically to the sealant. So that's the first step. It's critical to encourage the bond strength, and then likewise when you debond it, it makes it quite a bit easier because you don't have the heavily filled paste actually contacting the etched enamel. You have an unfilled sealant and then the heavily filled paste on top of it. So the sealant's actually like a buffer.
What do you mean by filled? I know that bonding agents are composed of resin and a filler, right?
Right.
You want to discuss a little bit about what the filler is all about?
The filler is where you actually get your strength. And all of your composite materials today are made up of two categories, and that would be resin and filler. And the filler would either be glass beads or quartz beads, whichever the manufacturer chooses. And the filler actually does prevent shrinkage during polymerization. Any shrinkage that may occur during polymerization or throughout the course of treatment, and this can be an ongoing thing, can definitely reduce your bond strength. So in order to get maximum bond strength, we land up putting about 70 to 75% filler depending on the type of material that we manufacture.
I think it's time to have you demonstrate the proper preparation and application of the sealer we'll just use this model here for demonstration purposes.
What I've done here is I've put one drop of each Part A and Part B sealant onto a mixing pad. And the mixing procedure with the sealant obviously is very simple. It's a quick 3 to 5 second mixing just to incorporate the Part A into the Part B. And then attempting to stay away from the gingiva, because under the gingiva there's always going to be a pocket of saliva that can easily be pulled down onto that etched enamel surface. So in this manner, try to go from the incisal towards the gingival surface, or you can go correspondingly the other way from the gingival towards the incisal, but once again be careful not to get the brush up under that pocket of gingiva. And then likewise on the lingual surface. And it's just a very, very thin coat. This is not a very precise or critical step. It's a critical step, but not a very, very precise application. So you can put a very, very thin coat on it, coat all the teeth, and then you're ready for your next procedure to actually cement the appliance in place. Now, one note here. The question will be posed as to whether you can allow the sealant to polymerize or bond the appliance while it's still wet, and that has no bearing on it because this material, this sealant, will polymerize underneath that paste, regardless of whether it's already set when you put the paste on or not. So that has no effect on strength.
All right, I suppose now we're ready to actually mix the adhesive. And this particular product, which you have called Excel, has the properties that we talked about before.
Exactly. What we've you've done here with Excel, and you'll notice as I dispense out on the mixing pad, as I get into the mixing stage, that it is a very thin material. So we do have the advantage here of a material that will flow easily onto the appliance, can be spread around on the appliance to fill all the crevices that it has to go into, can easily be punctured. If there are any bubbles that are inside the appliance, it can easily be punctured. And then also, because of the viscosity, as you place it, it will allow you to make sure that the appliance is seated firmly in place, and also your excess will definitely flow out from under it.
All right, now, just before you mix, then it would be necessary to prime the appliance once again with the plastic bracket primer. That's correct?
Exactly. Right before you go, just a very thin coating.
All right, I'll go ahead and do that while you start the mix. And once again, this is applied all the way throughout the inside of the appliance, including the occlusal surfaces, because we do want that bonding agent to etch or to connect in that area. Is that correct?
Right, exactly.
Okay. That's good.
Now, as we see here, I've already dispensed equal portions or thereabouts of the Part A and Part B paste. Now, from the start of mix, and the mixing time, once again, should be about 10 to 15 seconds maximum, enough to thoroughly incorporate and get a uniform color. The working time from the start of mix is 3 full minutes. So that gives you more than enough time to mix the material, place the adhesive paste into the appliance.
All right, now what I will do is to go in and to entirely fill the opening areas in here. I don't know that you gave me enough paste. Oh well, such is TV. If I don't have enough paste, I'm not going to be able to show the...
Yeah, keep going here. That's okay. I'll get this. I got a bunch here for you.
Thank you. Now this part is usually done either by myself or by a chairside person. It's not really critical who does it, as long as you get a very thick amount of material in here covering all the particular areas. You want to make sure that there are no voids.
This is critical that because of the thin viscosity, and you can now go back with your spatula and poke it into various areas in the appliance that have paste in it to make sure there are no air bubbles in it. If an air bubble was to fracture in here, it could lead to a pocket, a void, and eventually decalcification.
All right, now we're going to place this on the model. We're going to bond it actually to the model in much the same way that we would do in the mouth, and I'm putting very firm pressure on it. And usually by this time, the material will this appliance will snap in place. Then the first thing we do while this is warm, or still soft, I mean, is to go around with a Q-tip. And of course, it's much easier to do this on the model than it is in the mouth, getting away all the excess around the sides. You can also do the same thing with your finger. We use many Q-tips. Now, if you're coming in from the oral area, of course, it's very, very difficult to get around the back side of the appliance. And so what we find that a regular hygiene scaler is very nice for getting right along the gingival margin. And here, you can see that I'm picking out some material. And most critically, around the backside of the appliance in the area of the distal end of the first molar, because this is oftentimes an area where we'll have a significant amount of flash. So now that we've checked this completely, you'll notice that initially the material is quite soft in its appearance. It becomes much more tacky, and then finally, if after the complete set has occurred, it is virtually impossible to get off the appliance without using a high-speed handpiece or a burr of something of that sort. Looks like it's, oh, I missed a spot over here. You can also see, now it's starting to get quite hard, and it appears to be not the nice smooth area that I had before. That's very clean. So we have just about bonded this into position. Now, how about as far as what I did? What would you suggest that I would do differently, or anything that I would have left out in describing it?
The way it was performed was fine. I didn't see any problems there at all. One thing to remember, which is critical, is that the reason why this material was developed and formulated in this manner was to give you and your staff adequate time to be able to do all these things. The mixing, the placing in the appliance, which is critical, make sure there are no air bubbles, to be able to place it and do your cleanup. And all this generally does require a good 2.5 minutes worth of working time. If you were to bond this appliance with a lot of the other standard materials, even some of the materials that we manufacture, which have a shorter working time, you run the risk of bonding this appliance during the gel period. And that's actually the period when the material is starting to set. And if you bond it during that period, once again, as we talked before, you will significantly reduce your strength.
Now, I think that one thing that's sort of unique about these appliances is that they usually snap right into position. And so I think perhaps you can do some cleanup during the gel phase.
Absolutely.
But it's a matter of making sure that you don't jar the appliance. Do you agree with that?
Right, definitely. I think the biggest problem comes into play is that if you are using material that is setting quickly, and you have it on the appliance, and you're hurrying to get it in the mouth, and it's actually starting to gel as you're placing it in the mouth or as it's starting to be seated. Now, once again, your fit could be thrown off, and once again, there could be gaps, there could be voids, there could be a lot of problems that you could encounter with that.
Yeah, we had one incidence of placing one in the mouth in which we, in fact, did not get it seated all the way along or all the way in place on one side, and some significant decalcification resulted from that. So this is a very, very critical step.
One of the questions that I have posed to me quite a bit is how do you get the appliance off and the easiest way to remove it?
Well, I'm going to hopefully demonstrate how to get this appliance off using an ETM 349 plier. All right, the ETM 349 plier is a bond removing plier, and the unique aspect of it is this very, very sharp edge in the front, which gets very nicely underneath the appliance and allows you to pry it off. The Herbst appliance is removed in the mouth using this pair of ETM 349 pliers. The very sharp edge of the pliers is placed at the gingival margin, and the pad is placed on the occlusion. And then usually you'll take the appliance off, boy, that came off very nicely, by just a rocking motion, very much like you would be opening a jar of peanuts or something of that sort. And then again on the other side, just taking it and working your way around like so. This side's a little bit more realistic, and then finally it just pops off. Now you'll notice that on the inside, you can see this here, on the inside of the appliance, there is a somewhat opaque material. Remember, this is the same appliance that we just bonded. That completely covers the occlusion, or the marks of the occlusion in the appliance. On this side over here, where we had a little bit less bonding agent, some of the acrylic, the plastic part or the shiny surfaces of the acrylic are still visible, which would indicate that perhaps I got more of the bonding material on the right side than I did on the left side, and that if I were to evaluate which one were the better of the two, certainly the right side would be that. Because we should make sure that when you take off the appliance, that there should be a complete, very thin line of the bonding agent visible on the inside of the appliance.
Do you feel that this seals the appliance and prevents any seepage underneath the appliance?
Yeah, usually the part of the appliance that we find that there is some food discoloration or so on is right in the gingival margin, as in here. And normally if you see that, there's no evidence of any kind of decalcification. It's when you begin to see voids in the occlusal area that this can be a problem. Another problem that you can have is if the patient wears through the appliance and makes an opening into the occlusal area, which we of course have not etched. And as soon as you see any kind of decalcification or discoloration, or if there's an odor or any kind of bad taste, then that's something that the patient should be advised about, and that as soon as that were to happen, I would immediately remove the appliance from the patient. Thank you, Paul. I think we've covered most of the material that I wanted to deal with today. And presumably, I feel very strongly, of course, that the proper product should be used when dealing with a bonded Herbst or with a bonded rapid palatable expansion appliance. And I think that people can get into some serious trouble in using the wrong type of material. And I thank you for going to the trouble and effort of working out this particular system.
Thank you for having me.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.